Hi, everyone. Welcome back to our Caregiver Empowerment Program. Today, we're going to talk more about acquired brain injury. So, in our last webinar, we spoke about various kinds of acquired brain injuries, how people can sustain brain injuries, what the impacts of those are, especially on their care and support needs. So, today we're going to look at more information about acquired brain injuries. Specifically, we're going to look at the rehabilitation process and recovery. We're going to talk about some of the principles of rehabilitation. Very importantly, though, we're going to look at strategies for supporting not only the individual who's living with an acquired brain injury, but also strategies to support the individuals who are looking after those people and who are caring for them. My name is Dr. Charlotte Capri. I'm one of the senior clinical psychologists with NUA. And it's so nice to have you guys with us and to share this information with you. Thank you so much again for joining. So there's four main things that we'll be looking at during the course of our webinar today. So as I said before, we're going to look at the principles of rehabilitation, and we're going to look at resources and care pathways for rehabilitation in Ireland after sustaining an acquired brain injury. We're also going to look at strategies for living and coping with changes in memory and thinking and communication, as well as suggestions to improve emotional well-being. We're also going to look at how carers of people with an ABI can actually access their own supports. And lastly, before we end off, we're going to look at improving quality of life for people who are regaining skills after an ABI, but also for people who are looking after individuals with an ABI. So this is our content for today. And I'm going to move on to our first topic, which is the principles of neurorehabilitation, right? So somebody with an ABI is going to go through a process of rehabilitation, neuro, brain, so neurorehabilitation. So if we think about how to define neurorehabilitation, it's an active process, and it's very much an organic process. It's not linear. You're working towards a goal, but there's always other things to consider. And you might take one step back and three steps forward, and new needs might come up, and new support strategies might need to be thought about. So it's a process. It's a very active process. Lots of people are involved as well. Whereby people who are disabled by injury or disease work with staff, professionals, relatives, members of the wider community to achieve their optimum physical, psychological, social, and vocational well-being. Okay, so that's neurorehabilitation in a nutshell. So following an ABI, as you've heard before, people may struggle to accept the difficulties, how their lives have changed, things that they haven't been able to do anymore, or drastic changes to careers and to families, and people might become very anxious about becoming reliant on other individuals. Before the traumatic brain injury, before the ABI, they were highly, highly independent adults, and now they're relying on other people for support. We're going to look a little bit more about how to actually think about that, and strategies to actually support people with that. But really, guys, the aim of rehabilitation is to promote as much recovery of independence and quality of life as possible. So it might never be a recovery to the same level as it was before the acquired brain injury, but whatever it can be, that's what we want to help the person attain. So the philosophy, the ideas behind rehabilitation, why? Like, how do we think about rehabilitation? Like, why? What is it about? So as you guys learned in the previous modules, right? Every brain injury is different, which means that every person's recovery process is going to look different, and it's going to be different. The one thing that is the same, though, is that there will be a comprehensive multidisciplinary team that will approach supports and rehabilitation along with the person with the ABI. So, the team might include physiotherapists or physical therapists, speech and language therapists, occupational therapists, medical staff, psychologists, counselors, um, you know, um, clinicians from all kinds of disciplines, but they come together to provide person-centered rehabilitation, person-centered planning behind somebody's recovery plan and rehabilitation plan. And really, they come together from their various disciplines with their various knowledges and expertises. Um, to figure out the best way for this individual in terms of adjusting, adapting, and learning to accept this new life, this new process, to regain skills, new ways to cope, to re-engage with this different life, but in a meaningful way, and to ultimately work toward community reintegration. To have as many functional independencies as possible, and to achieve some sense of meaningful productivity, and meaningful contribution, and as far as it's as that person would like, and in the way that that person sees their life being fulfilled to its potential. So it's about effective communication within these teams, because there's so many disciplines, right? And not only within teams do people need to get together and plan and talk effectively, but also among services, right? So our individual might be in a particular rehabilitation service, but we still need to link in with staff that have treated them maybe when they just came into hospital, for example. So across services, that communication also needs to remain healthy and constant. We want to promote hope, but we also want to manage expectations. And remember earlier I said it is about fulfilling potential. It's about getting back to as much functional independency as possible, most likely not to the same level it was before the injury. So we need to just manage those expectations. At the same time, we're instilling hope. We're encouraging that recovery. We're encouraging that achieving of the realistic goals, right? It's about information, it's about education, and how to best tailor that to our particular individuals' abilities and of course their needs, right? Because remember, we were saying last time how, depending on how your brain gets injured, you might have difficulties with communication, with understanding communication, giving communication, with remembering things. So when it comes to the education and the providing of information, we need to think very carefully what is going to be the best way for this person to receive this information and to deliver it, Of course, including families, including relatives, involving the service user as much as possible in their own treatment. Like how would they want to direct their own treatment? So that piece of empowerment in there. Of course, there's cognitive rehabilitation, and as you know, communication is going to play a big part. So we want to achieve goals. We want to set those goals, right? We need to do that in a collaborative way between his team or their team, their NDT, and the individual themselves. So it's a constant active process. It's an active conversation that takes place. It's not the team knowing what's best, or the team not consulting with the person with ABI. It's, what do you need? How do we help you? Where do you want to be? How do we get you there? Right? Because these goals need to be personally meaningful. It's of no use if I set a goal for someone and it has absolutely no meaning or interest for them at all. What's the chances they're going to be motivated? They're going to want to reach that goal. And we're going to use SMART goal setting. And I'm going to take you through what SMART goals are a little further in our presentation. So SMART is an acronym. Just keep it in the back of your mind in the meantime. Um, There's going to be regular reviews of this active process of rehabilitation. We're going to go and we're going to reassess, where are we now, and what do we still need to do? Have new things popped up? Have we achieved some of the smaller steps that we wanted to? We're going to, obviously, the independent functioning is always at the forefront. To what point and how much and where and when, and of course, you guys, the daily, real, everyday skills that we need for getting through life and getting and doing it in a way that adds quality and that adds meaning to an individual's life. Community reintegration. Now, as we'll go on in our presentation today, for some people it might be more possible than for others. But if we think about community reintegration, it's about a rethinking, reframing ways of participating in roles in life. Maybe before the acquired brain injury, a person was a parent and an educator and a student and a volunteer. So various roles that person had in the community before the ABI. To what extent can we help? Can we support, assist a person to attain that again, and in what form, and what is that going to look like? So it's about inclusion, not just in the home, not just in the rehabilitative environment, but also in the broader community. The importance and the sense of belonging within social networks, and developing those connections again. And they play quite a big role when we talk a little bit further today about some of the psychological supports for people. Meaningful activities, gainful activities, and having a reason to want to tackle the day, having something to go for during the course of a day. So I suppose one would say, something that would keep one engaged, like occupationally engaged. Vocational rehabilitation and choices. There's a lot of independence in being able to just make choices and act on decisions, and promoting independence for that as well, where possible. Okay, so let's talk a little bit about the pathways of recovery and rehabilitation in Ireland in particular, following an acquired brain injury. So, guys, there's something called the Slinky model. And I'll get to it in a second, why it's called the Slinky model. But let's stop and let's talk a little bit about rehabilitation and recovery following an ABI in Ireland, right? So I think one thing we need to we need to appreciate is people's brains get injured in different ways. They're going to have different active processes of rehabilitation. They're going to have different needs. They're going to be affected in different ways. In other words, recovery for every person is different, and it can take years for some people. And for other people, it might take months, right? So different people need different input at different stages of their active recovery process. So there's something called the Slinky model of rehabilitation. So as you can see, it's like a cascading kind of process. You guys remember those? There used to be these Slinky toys. I don't know if we still get them. They were like these spirals that you would tip them over at the top of the stairs, and they would kind of like it'll kind of push itself down the stairs like this weird slinky worm, right? So that's where this comes from, because we're starting at the most acute level of care needed, right? So intensive care, right from wherever the traumatic brain injury happened, the scene, straight to hospital, straight to where a person needs to be to have their life saved, to be assessed, to be admitted to hospital for most likely a very long time. And as they recover at that level, they might then be discharged to a general ward. Maybe there, the occupational therapist, the physical therapist, maybe there some of the rehabilitation work can already start. The language and speech therapist might come in. When those at that level, when that kind of recovery has made some gains, the person might then move down another level of care. A little bit less support, a little bit less intense. So what I'm trying to illustrate is how recovery can be initially the process can be very acute, very urgent, very intense. Life-saving measures, and as the person recovers at every level, they kind of move down, they step down, they slink down, so to speak, to the next level of need and the next level of recovery and of this active process, right? And sometimes they might need to go back. Maybe a brain bleed, maybe, and they might have to go back into hospital and back to see their neurosurgeon, and then they slink back down, along their recovery process. And it looks different for everybody. So let's begin. Let's begin at the top of the slinky model, right? That acute care. So as you guys might imagine, most cases of acquired brain injury, the first place that they normally arrive, the first place they're normally seen is the emergency department, so the A&E at hospitals, right? The injury, depending on how severe it is, it might require specialist medical input. The person might need to go to a complete different hospital, for example, Beaumont Hospital, maybe, where they will most likely receive very acute medical care, brain scans, diagnostic tests. They might even be placed in a medical coma, just so their brain and body can recover a little bit. They might need to be treated for other injuries. They might have been in a road traffic accident, for example. So apart from the brain injury, there might be other injuries that need treatment. They might even require a neurosurgeon. So then we come down, the slinky is coming down the stairs, remember? So our person has recovered now out of ICU, so post-acute, right? The next kind of like down step. So the person has been stabilized, their neurorehabilitation can begin. The MDT starts stepping in. A care plan is designed, a care plan is made for the onward care, with input from the whole medical team, the family, for example, and of course, preferably the person themselves as well. The length of the hospital stay obviously also depends on the care that is needed, and one already starts to think, and perhaps this is part of the active process and the hope and the recovery, is thinking about discharge, thinking about what is the next step for this person going to be. So is it community-based rehabilitation, right? Is the slinky coming down the stairs to the next lower level of the active recovery process, which is community-based rehabilitation? So, a person might be found to be ready to leave the post-acute inpatient care, where they received physio, they received speech and language, they received occupational therapy, and they could be discharged, into perhaps a community residence, for example, maybe home. But of course, they can return up the levels of acuity as necessary, right? They might need to go back to an inpatient rehabilitation ward. Maybe some of the gains made in physio, for example, just need to be caught up again and brought to level again, right? So community-based supports can also help a person continue their rehabilitation. Like I said, either living in their home or in a residential setting, right? So residential rehabilitation. It might be necessary for a person to be in a couple of longer term supports, maybe from higher support needs, and then as the recovery process goes along, those support needs might become a bit lower. So returning to the community after a stay in the hospital, immediately returning might not always be possible. So even that might be a stepped and a graded approach. And residential rehabilitation then, kind of as one of the down steps, provides long-term care to people in a residential setting, rather than in their own homes. So, rehabilitation and recovery in Ireland, guys. As we go on in this webinar, and this is about the time where I'm going to start to remind us all of this, we've signposted some really, really handy materials that are accessible and that are available for you to download, and you'll find them in your you'll find them accessible during the course of this module, and in your materials. So there's tons of websites you can go to. There's strategies you can download for yourself and go through them yourself in your own time, scribble on them, make your notes, change the things that you think aren't going to work, and change them to things that you think are going to work better for you guys. So we're moving on to our third topic now, which is specifically around tips and strategies of managing cognitive changes following an acquired brain injury. So just to get back to what I said a couple of seconds ago, all of these strategies, all of these tips, you will find that you will have access to, and that you can download them for yourself. You can print them for yourself. You can make your own booklets. You can make your own files. And please use these resources by all means. I'm just going to talk very lightly over them because they are available for you to make your own. Okay, right. So, cognitive rehabilitation, as you guys know, cognitive difficulties are really common following an ABI. Remember last time we spoke about how our memories can be affected, how our attention spans can be affected, our ability to think, our ability to use our thinking, our reasoning skills. Now, some of these problems can improve as the brain recovers, but these improvements might just be fleeting and they might not be long lasting. Yeah. So, for example, for memory, you'll see in the materials that you have access to that you can download, there's all kinds of really, really cool hints and tips and strategies for memory. How to remember appointments, like how to remember what to ask. But yeah, I'll when we get to those slides, I'll just remind us again. Okay, so one way of figuring out what a person's particular cognitive difficulties are going to be is through neuropsychological assessment. And it is a clinical psychologist or a neuropsychologist or a occupational therapist who can conduct those psychological assessments. So what do these do? What do these assessments do? Well, they kind of like map out and help with planning, and they help plan the recovery, they help plan the rehabilitation process, because they help us to understand and really quantify, like really get a sense of how the brain was affected, and how severe the brain damage is on a person's intellectual, motor, and emotional functioning. And these tests also show the severity. They also show the extent of how the brain is damaged, and the results are also used to, like I said, to plan and personalize a person's active process of rehabilitation and recovery. So this is where I get to remind you about the downloadable material that you get to print out, and that you get to keep, and that you get to make your own, right? So we have some advice here on strategies for memory difficulties. For example, getting back into a routine. What are some of the strategies for supporting a person with an ABI who now has memory difficulties, to get back into a routine, to get back into something familiar, reliable, predictable? You'll find all of those hints and tips in your material. How to help them reorganize their home, for example, in a way that will reduce the demand of having to remember things and having to pay attention the whole time. Because not only might those functions be be impaired now. Um, depending on how severe an acquired brain injury is, a person tires perhaps much quicker now from having to concentrate, having to focus, having to remember things, right? Um, in your the material that you can print out for yourself, you'll see there's hints and tips and strategies on prompting somebody to use these tools, that support them in their memory, and to support with improving their general well-being as well. Okay. Um, you'll get some advice in the materials on, for example, memory aids like an organizer, right? So, in what way would an organizer be useful as a way of supporting somebody with memory difficulties after an ABI? We all know diaries, right? Wall calendars, for example, alarms and timers, electronic calendars. So especially alarms and timers. Most of mobile phones have alarms and timers. And in terms of electronic calendars, most smartphones these days and many computers have electronic calendars. And then there's also some of the supports that you'll be able to refer to, and some resources there on supporting somebody with an ABI who might have memory difficulties now in managing their bills, right? And maintaining their utilities, the heat, the lights, the gas or the oil or whatever that might be, the bins, for example, to not have services cut off. So there are strategies and ways of supporting people to kind of remember these things. And right, so you'll also find information on, ways of supporting people with ABI on reminding themselves what happens at appointments. So this can be a two-way kind of street. So the person might be supported by writing things down that they want to ask the practitioner, the GP, for example, things that they're worried about, things that they want to find out more about. And at the same time, in this appointment, they might want to make notes of what the GP is saying, what the GP is explaining, the answers that the GP has for the person's questions. Because somebody with an ABI, there's every chance that half an hour after the appointment, they might have forgotten the advice that they were given, right? So please refer to your materials and please refer to the resources for those strategies of supporting somebody to be reminded of things that happen in the appointments. And then reading information, right? So you were now given a booklet at the GP's appointment on, for example, ABI and um, how that might impact you, and various things to look out for, and various things to take care of and think about. But now you have to kind of read this information and you have to make sense of it. So in your resources, you'll see that there are strategies there for supporting somebody to actually make sense of this information that they are that they have access to by reading, by means of reading. And also remembering, maybe before the ABI, the person just kind of like automatically didn't even need to think about how to get to the shop. They didn't even need to think about where to go and where the post office is, or where to go and pay the phone bill. And after the ABI, however, we were speaking in our previous webinar about how the ability to kind of like orientate yourself, read a map, Surroundings, familiarize yourself with your surroundings, figure out a bus route, figure out how to get somewhere. Those things might have been severely impacted. So in the materials that are available for you to download and print and keep for yourself, you'll see that there are strategies there of supporting people in remembering how to get somewhere and how to figure that out. And sometimes one of the things we find with people with acquired brain injury is not being able to remember things that were actually quite recent, like what they recently did, what was recently said, where they recently went. And sometimes it can really affect them, and they can take it, that they can take it quite harshly. And it's quite hard on them. So there are supports there as well, strategies for helping somebody remember what they did recently. There's also strategies there in the materials for remembering people's names. And many of us, we might not have gone through an acquired brain injury. Even we struggle with remembering people's names. So to be fair, there's some of these hints and tips that, that might be useful in our everydays as well, as carers of people with ABI. But these are really handy, for us as carers and as people who support individuals with ABI to remember people's names. Now, it might be people that they've known, it might be people that they've met and they've known very well before their ABI, but the brain's ability to retrieve that person's name has been wiped out. So it's not necessarily new people. It might be people that they know whose names they just cannot find. So really cool strategies there for helping people with names of individuals and of things, right? Naming things. And then putting things down and forgetting where they are. I mean, we all do that from time to time. Now, somebody with an ABI might also now struggle to solve that problem, to figure out, okay, how do I try and remember what did I do with my keys when I came in at the door? So what many of us would do is we might retrace our steps. We might think, what were we doing before we came into the door? What did I have in my hands and where did I put that? Now, somebody with an ABI might not be able to take that step of solving that problem, right? So they late for their GP appointment, which they're remembering because they're being supported with those remembering appointment strategies, their diary, for example. But now, where are the house keys? Right. So in this resource pack, there's really cool things for helping somebody remember how to find things after they forgot where they put them. And also making sure phone messages are passed on. So perhaps somebody is a resident in a neuro-rehab home, right, with other individuals with ABI. Maybe they're back in their own home. They answer the telephone, and there's a message for somebody who isn't in at the moment. While the person is telling them the message, they remember it pretty well. But once they have to give the message back, they're not able to recall it, right? So information can get lost. It might have been about a doctor's appointment, So how to support somebody with passing on phone messages, how to support somebody to take their medication and to take their tablets and to remember that, how to support somebody when they're really confused and they don't really understand why they are so forgetful, and instead of beating themselves up about it, to support them with understanding, and with some kind of like self-compassion around that, That's all in there, guys. The same with attention difficulty. So in your resources that are available here for you to download, there's some really helpful strategies for people around attention difficulties, how to support somebody to make it easier to focus on words that they're reading, to cut out background noise, to remove distractions when they're using the internet, for example. All of these pop-ups and all of these kind of like adverts and messages. How to make planning the week easier. So strategies on supporting an individual with planning, planning out their week. strategies to support, as carers, for us to support people with an ABI around how to make it less stressful, to be doing more than one thing at a time, and how to make it easier to focus and to concentrate on a task that has more than one step, right? That has a number of steps that must be done in a sequence. Yeah. First, you boil the water before you make the tea. You don't just take the water that's in the kettle and pour it in the coffee cup. It might not have boiled. Yeah. So strategies to support somebody to remember what those steps are of a task. How to support somebody to reduce visual distractions, in their environment while they're busy doing a task, or doing a hobby, for example. How to cut some of that environmental distractions out. There's some handy tips and strategies in your resource pack there. How to support somebody with an ABI who now has attention difficulties, with doing a task, with doing something that is actually quite important, and to support somebody, making to kind of like make it easier to recognize and to filter and to pick up what the most important messages are, in a document, for example. Maybe there's a new um, uh, um, electricity and gas provider contract, right? While the person is able to read still after the ABI, it's making sense of that information and not feeling completely overwhelmed by all of the words, and processing all of that information, right? So in the materials, you'll find strategies to help somebody with identifying the most important things in that contract, the most important things that they need to know about their new gas or electricity provider's contract. Um, you know, um, Supporting somebody with keeping track of what's being said. For example, there might be a family gathering in the home, and the person is struggling to keep up with various conversations that are happening. The person might have, after their active process of rehabilitation, after their stepping down their slinky model, they might now have returned to work with supports. One of those supports might be how to keep track of what is being said in meetings, for example. So in your resources, you'll see there are handy strategies there to keep track of what's being said in meetings. How to cope and how to manage with socializing in noisy groups. Strategies there for managing those difficult kind of situations. It's all in there in your guys's resources that are available for you. So SMART goals, right? Remember way in the beginning I was saying rehabilitation, the active process of rehabilitation and recovery. It is about achieving functional independence to a realistic level, to what is possible. It's that hope. It's the goals, and in this sense, SMART goals, setting SMART goals throughout the recovery process, as skills develop and as new skills need to be grown, or as needs change, those SMART goals can also change. So what are SMART goals? So as I said earlier, SMART is just an acronym, right? But after an acquired brain injury, it might be difficult, as we've seen now, to plan things, to set and to achieve goals. There's all kinds of strategies there, like we mentioned earlier, for some of the steps that you'll need in your SMART goals. But we normally talk about planning and organizing as those executive functioning skills. Remember in the previous seminar we were talking about how especially frontal lobe injuries, can really, really negatively affect your executive functioning, impulsivity, planning, organization, inhibiting yourself, switching, judgment, insight, all of those things, right? So what are SMART goals then, and how do they help? How do they help in the recovery process, in the rehabilitation process? So SMART goals are specific, they're measurable, attainable, they are relevant, and they are timely. Yeah. So it's a kind of approach, a smart approach. A SMART goal is a kind of approach to achieving goals. It's not specific to ABI. Anybody can use them. Even in business, even in their personal lives, for managing time better. It makes the goal more realistic. It breaks it down into smaller, manageable steps, that are achievable within certain time. Obviously, they must be relevant to the person. Otherwise, where's the motivation to actually achieve the goal? That's where the inclusion, the collaboration, the self-determination comes in, the personally meaningful goals. And SMART goals also support cognitive functioning by providing external structure, right? There's something to refer to. There's a plan written down. And then again, you will find in your sample tools section, you can find all of these strategies to download and use for future reference. They're in your learning management system, right? So you can make them your own, you can print them out, you can use them in the ways that are going to best suit you and best suit the environment that you are providing support and care for someone with an ABI. So topic 4, emotional well-being. We spoke in a previous slide about some of the psychological impacts, some of the emotional impacts that an ABI can have on an individual, right? And there can be a range of emotional problems. These problems can be a result of the areas of the brain that were damaged, right? Or also the process of coming to terms with how different life is now, having this ABI and how it has changed things, sometimes very, very drastically. While some other difficulties can be seen, after a road traffic accident, for example, there are scars, there are bruises, there are injuries, there might be broken limbs and casts, crutches, for example. Emotional, psychological problems can be more challenging, but also invisible. So it's not really always easy for support people, carers, and family to see that somebody is struggling emotionally or psychologically. So there is Headway in the United Kingdom. Headway UK provides such cool information on the link between psychological health, emotional health, mental health, and brain injury. And I highly, highly, highly encourage you to have a look at Headway UK's information. And we do provide you with a link to their materials in this webinar as well. Guys, dealing with stress, that can be one of the big emotional tolls for us in general. But, if you have an ABI on top of being a human being, the coping and the managing and the sorting of stress can be stressful in itself. So somebody with an ABI, any human being, when they're stressed, has certain kind of like physical reactions, but there are also feelings, anxious, worried, frustrated, tense, and irritable. So now, how do we support somebody with ABI who is experiencing not only the physiological effects of stress, but also these feelings, these like stressy feelings? So it's about supporting a person to recognize when they're stressed, to understand their stress and anxiety, to have information about that, to almost make it, to almost normalize it, that of course it's totally understandable that you would feel stressed and that you will feel anxious, and helping and supporting with coping strategies, with perhaps talking if a person is able to to communicate in their way, or whatever they need to use to communicate this, and some positive self-talk and positive affirmation statements about themselves, to support people with that, can also be very, very effective. And as we know, stress anxiety, worry, depression. In our previous webinar, we also spoke about how those are actually quite expected and quite prevalent after an acquired brain injury. So after an ABI, some people do experience low mood or depression. And I just want to recap those symptoms, right? So what do we look out for as carers of people with an ABI? Are they reporting, or do they look to us like they're feeling down in the dumps, low? They've stopped doing things they used to enjoy doing. They don't want to engage in those activities they used to enjoy before. They're irritable. They might talk about things that bring a sense to us that they're not really hopeful. There's no hope anymore. They feel helpless. They feel useless. They feel worthless. They might be sleeping more than usual, less than usual. They might be very kind of like, critical toward themselves and blaming themselves, not just for the ABI, but just, for everything in general. Motivation levels, energy levels, quite low. That get up and go that we spoke about last time is just, it's all flat, and really having suicidal thoughts, of just not wanting to be here anymore. Obviously, it's a bit of a continuum, right? It's kind of like, I just don't want to do this anymore. I don't want to be here anymore. And then on the other end, how am I going to kill myself, right? So there's a spectrum of these suicidal thoughts. So just some of the things that we need to be on the listen for and on the lookout for. So here are some useful strategies for supporting somebody with dealing with their possible depression, right? Talking, identifying what those negative thoughts are and challenging them, and identifying enjoyable and pleasurable activities, and really trying to support somebody to activate those activities, those enjoyable things, right? And hoping that by activating those behaviors, that the thoughts might become a little bit more positive, the emotions might become a little bit more lifted. Yeah. So, the people in the National Rehabilitation Hospital, there are some coping strategies here that they find very, very useful, and you might want to support the person that you're caring for with an ABI with these strategies, like talking about how they feel, understanding their brain injury. But now remember those tips and hints we spoke about earlier about strategies to help somebody understand what they're reading, to understand the information that they have about their brain injury, right? So let's not forget those. Supporting somebody with their goals, with recognizing their progress and celebrating those small things, even if it is from going down to one crutch from two. That is huge. That needs to be celebrated. Maybe using 6 words in a sentence and not 4. That's huge, guys. So really supporting them with identifying enjoyable activities and engaging in those activities, and just seeing how the behavior activation and the thoughts and the mood, and they all seem to want to just lift one another when that cycle gets going, lift them out of that funk. And then support, right? Encouraging them to meet with others, maybe with similar experiences. We don't know what it's like to go through an ABI. There are supports that we can give, but when it comes to really, really knowing what it's like, they might need to get that support elsewhere. There's also from Headway UK, and please visit their amazing website. Connecting with other people. There's so conducive to mental health. Physical activity, I'm sure somewhere along the line in your caregiver empowerment program, you guys have heard about the positive effects of just moving your body, the endorphins, and those feel good hormones, and really literally the science behind how those hormones actually do contribute to lifting mood, and wanting to do more of that activity to get more of that feel good hormones. Yeah, that's a cycle we want. Building activity into supporting somebody to build activities into their day. It might be small things. It might be getting off a bus one stop earlier, just to walk that extra 200 meters. Maybe um, cycling to a job and not taking a taxi, for example, and gardening, even, online workouts. And there's all kinds of ways of supporting somebody to just build some activity into their day, and learning new skills. Yeah, it's extremely rewarding, isn't it, and fulfilling to learn a new skill, no matter how small it is. Um, and always, when there is a dip, when there is a backslide, there's always general services for dealing with these difficult emotions. When somebody really is, you're extremely concerned about somebody's depressive symptoms, and they're talking about no, not wanting to be here and actually wanting to be dead, and they might have even thought about how they were going to do it. So the accident and emergency departments are there to help. Please link in with the GP, and please access psychology, counseling, and psychotherapy services. And again, these services, there are direct links there for you that we provide here for you on the third-party resources in your learning management area. Please visit your learning management area for these materials for yourself. And of course, we have to talk about caring for yourself following ABI. Up to now, we've been talking about how to support somebody with an ABI, but what about you? We know that uh, compassion fatigue, carer fatigue. We know that somewhere down the line, caring for somebody with ABI increases the likelihood, increases the impact of of exhaustion on carers. So there's a ripple effect. Partners, friends, family, carers, everybody is affected after somebody has a traumatic brain injury and an acquired brain injury. So it doesn't just affect that person, it affects everybody around them. And it's so important, guys, to make opportunities for yourself, because you didn't have an opportunity to prepare for this brain injury. There was no warning, right? You had to, initially, you were rapidly called to the hospital. You had to rush. You had to manage a whole bunch of things in the early stages, following the ABI. Have to rush to hospital, but now what about the stuff that I was busy doing in home, and there's work tomorrow, and oh my god, the car's in the shop, and there's that initial stuff, right? And then the individual is discharged from hospital, might be coming home, so the ongoing needs will impact the injury, the uncertainty, everything that this brings will not just impact the individual, but the carers themselves. So the speed and the success at which carers adapt and cope really varies greatly, and it's a process that is never easy. Just as ABIs are never the same for any person, a carer's experience of supporting somebody with an ABI is also never the same for every carer. So there are some strategies here to think about as carers of people with ABI, and that's understanding that there might now be a change in role. Perhaps you were not the person that was going out to work. Perhaps you were the person who was working from home. Now the roles have changed. Now, because of circumstances, you do need to go out to work. The burden of care has changed on you. The responsibilities have changed, have perhaps increased. And you might find yourself becoming more socially isolated. You're going out less because of the support needs and the care needs of the person with ABI. You're not seeing your friends or your relatives as often as you did. You're not volunteering as often as you did. You're not linking in with your support networks as often as you did. So your own needs become less important. They become neglected because of how urgent the care demands are of the person who has an ABI for whom you are caring. So we forget that to allocate time for our own interests and our own replenishment of energy, our recharging, our own relationships, and the things that we like to do in our downtime, right? We don't look after our own psychological and physical health. And we don't take time out to rest and relax and recharge. We forget that because it becomes less important than the care we need to provide for somebody with ABI. And we become fatigued. We get carer fatigue. We also go through a grieving process. And we need to understand that. And we need to have compassion for ourselves about that. And when we have the compassion, we might want to then feel that we are also allowed to take the care for ourselves too. And the really, really interesting research that Headway did here, and I would love for you guys to take yourselves to their website and to look at this. They did some really interesting research here. They found that most of the carers that they spoke to reported their financial situation becoming negatively affected by their caring difficulties, right? Their employments, most of them were very, very strained by the caring duties that were placed on them and their relationships. Many of them had to change their employment status. Many of them felt socially isolated. Many of them felt that they didn't receive adequate support in their caring duties. Very few people were satisfied or very satisfied with their own health, right? So just think about that for a little bit, yeah? Okay. So really to capture the experiences of people with ABI and their carers, to think about what they have most in common. What people found was that carers were saying, one thing that continually affects my family is coming to terms with a change in our family member. The grief of losing someone we still have, but it's not the same. So these are some common experiences that we have as carers of people with ABI. It drains you. It's hard work. Yeah. So there are services for carers. And again, please visit your learning management area. Please look at those third-party resources. And please link in. Please reach out, guys. So we've come to the end of what we're talking about today. I just want to quickly summarize for us. We spoke about the principles of neurorehabilitation, the pathways in Ireland to rehabilitation and recovery, the aim of rehabilitation, the philosophy, the focus of rehabilitation we spoke about, quality of life, recovery, functional independence as far as possible. ABI has a huge impact, not just on the person who experienced it, but the family and the carers. And we do need to look after ourselves as well. And please go to those signposted helpful resources for supports there. And before we started, and now, I bet you there's a big difference in your understanding of the guiding principles of neurorehabilitation, how that works in Ireland, the recovery process, a lot of strategies and tips you have there. Please download them. Please make them your own. How to look after your own emotional well-being, please. And how to support your own care. Please go to those resources for those supports. And here are some references for you to go to in addition to the links that we've made available for you to websites and the resources that we've made downloadable for you in your please go to your dashboard there. And thank you so much for your time, for your attention, for your interest. And we really, really hope you found this helpful. And please know that we do keep carers of people with impairments in mind. And we're always wondering how you're doing. And please refer to our resources whenever you need to. And thank you very much again. It was so nice doing this for you. Take care.